The respiratory system is an interconnected network of organs, tissues, and pathways that work together to help you breathe. It has two distinct sections, the upper respiratory tract and the lower respiratory tract. Both sections are connected to the external environment through the air we breathe. This exposure accounts for many respiratory system disorders. Let's travel within the respiratory tract as it journeys through our external environment. When we encounter the rhinovirus, we are likely to suffer from acute rhinitis, or the common cold, and its common symptom of green or yellow nasal discharge. Rhinitis can also result from allergies, although in this case, clear nasal discharge occurs. Allergies, bacteria, viruses, and fungi can all cause sinusitis, or inflammation of the sinus cavities. Facial pain and headaches are common symptoms. Moving along the upper respiratory tract, we encounter the tonsils. Tonsillitis is inflammation of the tonsils. With tonsillitis, swallowing becomes very difficult as the tonsils become reddened and enlarged. The next structure along our journey is the epiglottis, which is a flap that covers the trachea to prevent food from entering. Epiglottitis, inflammation of the epiglottis, is a life-threatening event as the air passage may become blocked. Often this narrowed passageway appears as a steeple sign on X-ray. Pharyngitis is inflammation of the throat, the common sore throat. Although most commonly caused by viruses, it may also be caused by the bacteria Streptococcus pyogenes and result in strep throat. Resolution of an S. pyogenes infection is crucial, as progression may lead to scarlet fever, rheumatic fever, or glomerulonephritis. Now, let's continue our journey into the lower respiratory tract, in which we may encounter bronchitis, pneumonia, or tuberculosis. Bronchitis is inflammation of the bronchioles, most commonly due to viral infection. The bronchioles become obstructed by mucus and leukocytes. Wheezing and production of red sputum may occur. Pneumonia is the result of inflammation, and the alveolar air space is filling with fluid. Bacteria, viruses, and fungi, especially in immunocompromised individuals, may cause pneumonia. Streptococcus pneumoniae is the most common cause of community-acquired pneumonia, whereas infection with Staphylococcus aureus is most common in hospital-acquired forms. Ventilator-associated pneumonia may also occur. Bacterial pneumonia may also develop as a secondary infection following a virus such as influenza. Now, let's talk about the most common infectious disease in the world, tuberculosis. Tuberculosis is transmitted through the inhalation of airborne droplets of Mycobacterium tuberculosis. Once inhaled, the bacteria settle in the lungs. White blood cells are unable to kill the organism, but are able to wall off the infection, resulting in a lesion known as a tubercle. As the immune system attempts to destroy the bacteria, damage to the lungs tissue results, causing a cheese-like appearance known as caseous necrosis. Clinical signs of tuberculosis include chronic cough, hemoptysis, and weight loss. Up to 20% of patients with active tuberculosis, however, may present with no symptoms.